and the Honorable Attorney General and Minister for Economy for providing all Fijians this courageous budget. I wish to also thank the Ministry of Economy staff, led by the Acting Permanent Secretary, in the short time of taking up his position, for a job well done in performing the arduous task of putting together a comprehensive budget. Mr. Speaker, sir, the Ministry of Health and Medical Services has been allocated a total of $403.3 million. With this massive increase, the Ministry of Health and Medical Services is well placed to see the recommencement of the long-awaited CWM Hospital Maternity Unit extension, the interior upgrade of Lombasa Hospital, refurbishment of St. Giles Hospital, emergency department at CWM Hospital, land stabilization and refurbishment at Savu Hospital, upgrade of Lautoka Hospital operating theater and X-ray department, and upgrade and maintenance of medical facilities around the country. With the latter, Mr. Speaker, sir, I would personally wish to see that the living conditions, workspaces, and stations of our ministry staff serving in the rural and maritime facilities, together with their families, are just as comfortable and stress-free as those working on the main islands and in urban and peri-urban areas, respectively. As I had mentioned previously in this August House, on my appointment as Assistant Minister for Health and Medical Services in 2016, the very first task I looked forward to undertaking was this very subject matter. This I commenced in December of 2016, when I was requested by the then Honourable Minister to a handing over ceremony of an ambulance donated by Loloma Foundation to the Taviuni Subdivisional Hospital. In accepting her request, I asked that I also visit the nursing facilities on Taviuni and Gamea Island, to which Madam Minister gave her approval. Upon my return, Madam Minister inquired about my visit. She was very surprised when I told her that if I had my way, I would shut down the Driketi Health Center on Gamea Island. In astonishment, she uttered, "Don't say that." I replied, "I take off my hat for the doctor and nurses at the facility for braving the inhumane conditions of their living quarters in particular, and the clinic." Over that weekend that followed, ensuing tropical depression 04F brought heavy rainfalls over the entire country, causing a severe landslide on Gamea Island, which pushed the entire health facility into the sea, taking with it a few homes and a portion of the school dormitory. When we met in the office on the Monday morning, Madam Minister said, "Area Minister, the Gamea Health Center is no longer." I replied, "God answered my prayer." There are many other facilities like the former Driketi Health Center that are in disrepair and in dire need of repairs and maintenance, and I am hopeful that I will be given the opportunity to be consulted in prioritizing the facilitation of repairs and maintenance to these in this financial year. Through the public-private partnership arrangements with Healthcare Fiji Limited, the New Bar Hospital will commence operations in December this year, while the Lautoka Hospital is scheduled to commence operations in March of next year and will have on offer, apart from the other specialized services, 24 hours in open heart surgery. Mr. Speaker, sir, the Ministry is committed to ensure that the upgraded and new facilities are supplemented with skilled and professionals, modern technology equipment, and support systems and medicinal products. Hence, the government's intention to hire an additional 238 intern nurses, 140 medical interns, 114 doctors, 10 nurse practitioners, and 43 midwives. The Ministry has also acquired the services of private general practitioners to relieve the pressure from the public health system. The Minister Ministry and the government, on behalf of all Fijians, wish to thank the governments of the United States of America, India, China, Japan, Korea, Taiwan, in particular Australia and New Zealand, for their unwavering support in the provision of vaccines, consumables such as PPEs, that is, face shields, gowns, surgical masks, gloves, and sanitizers, ambulances, vehicles, tents, nasopharyngeal testing swabs, pulse oximeters, regulators, respirators, thermal guns, ICT equipment, that is tablets, laptops, and Wi-Fi hotspots, megaphones, handheld radios, hospital beds, humanitarian assistance to NDMO, FRIEND, UNPFA, Fiji Red Cross, and the list goes on. Whilst we have turned our focus to the onslaught of this invisible enemy, we need to remain vigilant of other communicable diseases that have been around since time immemorial, such as tuberculosis, HIV, AIDS, and dengue. As a country with the second largest population in the region, Fiji has the highest tuberculosis burden among other Pacific Island countries. There were 480 new persons infected in 2018 and 43 deaths from the disease in that same year. In addition, an estimated 9 people with tuberculosis were undiagnosed. These cases are especially important to reach out to prevent the spread of tuberculosis. While the global response to COVID-19 has slowed the spread of the virus, it continues to have a significant impact on programs for other major diseases. For tuberculosis, this means a serious slowdown in diagnosis, treatment, and access to medicines. During lockdowns, missed opportunities for diagnosis and treatment initiation give rise to a rapidly growing pool of undetected and unreported tuberculosis. It is also important for the global community to recognize the importance of investment in health systems, strengthening and universal healthcare. These investments will not only help slow the spread of infectious disease such as COVID-19 and tuberculosis, but crucially will help ensure societies and economies are protected against future outbreaks. Bearing in mind that tuberculosis has affected people over 5,000 years, it is necessary to engage with outbreaks as soon as they begin in order to prevent long-term catastrophic costs to nations and their people. Evidence has shown that tuberculosis was found in the remains of mummies of ancient Egypt. According to the National Tuberculosis Program, within 3 months of lockdown and restrictions due to COVID-19 containment in June last year, tuberculosis services were extensively affected. Resources of the Tuberculosis Control Program were reduced considerably, which disrupted tuberculosis services further. These issues has caused emergence of new tuberculosis cases throughout the country, such as 1. Multi-drug resistant tuberculosis, or MDR-TB, cases emerged in Tailevu, which became a public health emergency and required the immediate screening of an entire village of 500 persons, treatment of clinically diagnosed cases, and tracing of substantial number of treatment defaulters. 2. Heavy community transmission of tuberculosis indicated by increased rate of treatment defaulter in Taveuni and Rambi, and new pediatric case in Mua. 3. Outbreak of tuberculosis case on Koro. 4. Operational issues such as malfunction of the only mobile X-ray machine for the control program and the lack of communication initiatives for tuberculosis. To respond to these issues, the National Tuberculosis Program has ramped up coordination with efforts with the Health Division to scale up and prioritize screening activities in hotspot areas where active index cases emerged or were diagnosed, especially during the 3-month lockdown period. A proposed list of urgent tuberculosis control activities were developed and need support for immediate implementation. As a government, we need to meet the targets agreed in the political declaration from the United Nations General Assembly high-level meeting on tuberculosis to be met by 2022, and the tuberculosis targets agreed in the Sustainable Development Goals to be met by 2030. Having endorsed the political declaration from the high-level meeting on tuberculosis, Fiji must now deliver its fair share of those global commitments and to set nationally relevant targets as per the United Nations high-level meeting targets. As a result of the impact of COVID-19 on tuberculosis services, it is imperative now more than ever to accelerate resource mobilization for tuberculosis in Fiji. To those Fijians refraining or not wishing to receive the vaccination for reasons known to themselves, let me remind them all that when they were born, they received the BCG injection, which was to protect them from TB. And at 6 weeks old, they received the DPT injection, which protected them from diphtheria, pertussis, and tetanus. During their school years, other inoculations were administered to every child. Only in November 2019 did the Ministry of Health and Medical Services run a nationwide immunization campaign due to an outbreak of measles. Why weren't there any repercussions back then, and why only now? I plead with all of you who are sitting on the fence, still trying to make up your minds, to please think of your children, your family, your community, your workmates, and your country by getting your vaccination. Mask up, keep your distance, don't share grog bowls and cigarettes, avoid crowds, wash your hands, install the Care Fiji app on your phone with the Bluetooth switched on, avoid unnecessary movements from your homes, and stay within your bubble. Mr. Speaker, sir, I am not one who expresses openly the invaluable services of our task force from the commencement of Operation COVID-19 in March of 2020 to date. But I can honestly say that I silently remember each and every member of our frontliners from within the Ministry of Health and Medical Services, the discipline forces, government ministries, FBOs, NGOs, CSOs, the private sector, and others in my daily devotions. I look forward to continue working together with the Honourable Minister, the Permanent Secretary, the Chief Medical Advisor, the entire Ministry staff and allied workers in taking forward the Ministry's vision of developing a healthy and productive population, and more so, to working together in fighting this invisible enemy, COVID-19, and leaving no one behind. With this, Mr. Speaker, sir, I fully support the 2021-2022 national budget, and I thank you most sincerely.
I thank the Honourable Assistant Minister for his contribution to the debate, and I now give the floor